Hello and welcome, viewers. You're watching Business World, and I'm Bhupendra Paintola. In today's program, we will be discussing over diabetes with Professor Shashank Joshi, Chair, International Diabetic Federation, Southeast Asia. Welcome, sir. Welcome to the program. Namaste. Sir, let me begin with the first question, which is in the mind of every Indian, I guess. Being the diabetic capital of the world, can diabetic be reversed? And if yes, how and what needs to be done?
So, Bhupendra ji, first of all, thank you so much for having me here. Uh, uh, you know, we have 8 billion people living on planet Earth, and half a billion plus people are suffering or living with diabetes. And among them, India is the second largest country on planet Earth with type 2 diabetes, and the largest country in the world with type 1 diabetes. These two types of diabetes are different. Type 1 diabetes, you need insulin to be taken for life, and type 2 diabetes is a lifestyle disease. Type 1 diabetes, people who have diabetes in pregnancy or secondary diabetes cannot be reversed. Let me again repeat that people who need insulin for life or people who are suffering from type 1 diabetes cannot be reversed. However, there is a term which is newly introduced called remission. And type 2 diabetes in the first 10 years, which is related to lifestyle, can be undergoing remission. We can undergo remission for type 2 diabetes by three methods. One is, of course, eating very less, which is less than 800 calories. And there was a trial done by Professor Roy Taylor where they ate less and had only a 600 to 800 calorie diet, and more than 50% of people after 1 year were able to remit it. Then we are undertaking a randomized control trial with a twin cycle technology where we are using precision nutrition, precision medicine, precision lifestyle, using artificial intelligence and trying to remit diabetes. And then medicines which are modern age, which make you lose weight, like the GLP-1 analogs or the SGLT2 inhibitors and newer medicines, they can also remit diabetes. And finally, if you are morbidly obese and you do surgery and you lose a lot of weight after surgery or endoscopic techniques, then also you can do remission. So remission means once you correct the underlying defect, there is remission for 1 year. But minute you go back to the old lifestyle, it may come back again. So remission of diabetes is something which is possible in type 2 diabetes, not in type 1 diabetes. In type 1 diabetes, you need insulin for life. But in type 1 diabetes also, there is a ray of hope for people living with type 1 diabetes. Because we are living in an era where there are transplantations happening. And some of our type 1 diabetics who undergo kidney transplant sometimes undergo simultaneous kidney and pancreas transplant. And this is also being done in India. It's expensive. And many of these people living with type 1 diabetes who have undergone both kidney and pancreas transplant, their insulin requirements have come down substantially. So there is a remission clearly feasible and possible through lifestyle and artificial intelligence and technology or digital diabetes care or eating low calorie diets or through surgery in the type 2 diabetes space. So people living with type 2 diabetes clearly in their first 10 years of diabetes, if they make some effort, are motivated, follow up a proper restricted diet pattern, yes, remission is a reality today. And we are generating more and more science and evidence in that direction. Bhupendraji.
All right. So type 2 can be reversed in a way, you can say. And type 1, it is very difficult, although there is hope in the first 10 years, as you have mentioned, right?
Type 1 is not possible unless you do a transplantation of the kidney.
All right. All right. So, sir, we have been after COVID, post-COVID, we have been hearing about the COVID-induced diabetes. So what reasons can we attribute to it? Is it because of the COVID or the drugs that we have taken in order to treat COVID, or it is because of the stress that was very pronounced during the pandemic? So what would you say of that?
So there are five reasons, like five fingers are different. There are five reasons in the post-COVID era, we get diabetes. The first thing is that people who did not have any diabetes, did not have any family history of diabetes, and they got severe COVID, particularly the first strain, ancestral strain, or the second strain, the Delta strain, or sometimes even Omicron, which is a mild virus. Okay, the COVID virus is RNA virus, and it went to the beta cells of the pancreas and damaged it and caused COVID diabetes, COVID-induced diabetes. Small rare percentage, but a small subset. So that's the first finger. Okay. The second is people who were pre-diabetic before COVID and they got COVID, particularly moderate, severe, critical COVID. They had to go to the ICU. That pre-diabetes got converted to diabetes. So that was the second thing. Third is many people who were living with diabetes, type 1 or type 2, they got COVID. And when they got COVID, particularly moderate, severe, or critical COVID, their diabetes got exacerbated. So that was the third finger of COVID. Fourth is people who had COVID, had diabetes, were given steroid medicines, particularly when their oxygen saturation came down, or they had a lung involvement with COVID. And you know that the original strain of COVID, the ancestral strain as it is called, as well as the Delta strain, they were affecting the lungs. And to save people's lives, we were giving steroids, and steroids increase the glucose. We all know that. So there was a steroid aggravation, and this normally lasted for 3 months. So that was the fourth reason of COVID. And finally, you rightfully said that in COVID, there was a disruption of lifestyle. And, all of us were sleeping less. We were eating more. We were sitting at home and having takeaway foods from outside. Our physical activity came down. We became more gadget oriented, and we became more sedentary. And we had a lot of mental stress because of uncertainty. And it's a combination of excess eating, wrong eating, less sleeping, less physical activity, and stress also led to more numbers of people being diagnosed with type 2 diabetes, particularly. So yes, these are the five primary ways COVID aggravated diabetes. And therefore, the numbers which we saw in the International Diabetes Federation, we publish an atlas every year, Bhupendra ji. And in 2022, November, which is 14th of November, is the World Diabetes Day. We just published the atlas. The 2023 report of IDF is also out. We are seeing that, just before COVID started, 2019, November, people dying due to diabetes was 4 million. And now in 2022, November, the deaths have gone up to 6.8 million. So yes, COVID has impacted lives and deaths for people living with diabetes. And
so the stats that you have mentioned is with respect to India, right? The six
are global.
Global.
These are global. These are global. So every 5 seconds or 6 seconds, we are losing one person living with diabetes. And we need to save lives, and we need to have a person living with diabetes to be free from complications. So COVID also aggravated, apart from these 5 factors, the complications of diabetes, because access to care was hampered. During COVID, digital care, but COVID patients were scared. They knew they were a vulnerable group, people with diabetes. So they were not going to their doctors and taking their advice and modifying their tablets or insulin. So it's very important. My appeal through your channel, Bhupendra ji, is that if you are somebody is suffering from diabetes and you have not seen your doctors for last 2.5 years, doctor won't get angry with you. Get your blood test done and go back to your doctor and get your medicines readjusted. And start eating, following a proper lifestyle, sleeping for a good 7 hours, trying to do some physical activity, at least some 8,000-10,000 steps, doing some yoga, some mindfulness and meditation, try to eat a little slowly, try to eat a little less, and then also sleep well for a good 7 hours. So it's important that you do lifestyle, go back to your doctor, and under medical supervision, get screened for complications, take the ABCD mantra of diabetes, try to keep your 3 months average sugar under control, blood pressure and cholesterol under control, diet and exercise, and take care of your feet. So it's very important. And I'm very happy that you asked this question, that COVID has impacted lives of people living with diabetes. And also we are now seeing more people being diagnosed with diabetes. Also, awareness has gone up. In COVID, I must admit one more thing, Bhupendra ji, that overall awareness of blood pressure and diabetes went up. And people went out there also and checked on their own with glucose testing machines. So that also has happened.
All right. So you were talking about the pre-diabetic stage, pre-diabetic level, sir. So I was reading a report by ICMR. It states that 5 to 20% in different states, people are somewhere pre-diabetic, and because they are pre-diabetic, they are at the verge of entering diabetic or being diagnosed by diabetes. So when it comes to the pre-diabetic stage, do we have only lifestyle changes as an option, or there are treatments or medications with respect to pre-diabetic stage also that would help us not entering the diabetes stage?
So, Bhupendra ji, ICMR in-depth survey which was done, I was the PI for Maharashtra State. It was led by Dr. Mohan from Chennai. And in that survey, we found that for every one person living with diabetes, one person was having pre-diabetes. And what was more important is that person living with pre-diabetes did not know, more than 50% or 80% of them did not know that they had pre-diabetes.
Yes.
Pre-diabetes is predominantly a lifestyle disease, but there are medications which cause weight loss. For example, in the Indian Diabetes Prevention Program, they have used a medicine called metformin. And in 1/3 of cases, it works. So lifestyle works in 2/3 of cases for prevention in pre-diabetes. And the medicine called metformin, which is cheap, available, accessible, works in 1/3 of cases. But it is a combination of lifestyle advice, which is the sacrosanct. Now, there are modern age drugs, which are new drugs, which cause weight loss, which are from the GLP-1 pathway or SGLT2 inhibitor pathway. They have not been tried in pre-diabetes. So we need to do some scientific trials, but they look to be attractive options which may be available. We also have starch blockers like acarbose, which have been approved for treatment of pre-diabetes in India. So in India, 3 groups of drugs are old drugs which have been tried in pre-diabetes, though they are not standard of care. Standard of care, and in 2/3 of cases, is lifestyle. One is metformin, second is, of course, the acarbose, and third is, of course, the old glitazones. But currently, what we advocate in people with pre-diabetes is lifestyle, and lifestyle. And newer drugs like GLP-1 receptor agents, oral and injectable, as well as SGLT2 inhibitors, will also have data. So there'll be 5 categories of drugs which will have data, so that the pre-diabetes to diabetes conversion will be less. So one more minute I would like to take, Bhupendra ji, with your kind permission. You see, worldwide, when somebody is living with pre-diabetes, it takes them 10 or 12 years to convert into diabetes. So somebody is living in USA or Europe, they take around 10 to 12 years. But if somebody is living in India with pre-diabetes, they convert from pre-diabetes to diabetes within 1 or 2 years. So it's a very rapid or a fast transition from pre-diabetes to diabetes. They rapidly transit. And that is really causing the problem in India. That's why we are having these explosive numbers. And we are suddenly the capital or the second number country in the world. And that is really the challenge. And that is why I want each one of you listening to this program, as well as you, Bhupendra ji, to be our IDF champion for diabetes advocacy, diabetes education, diabetes information. And I congratulate you, Bhupendra ji, that you are our IDF champion for promoting this cause for diabetes awareness, because more people will be aware for diabetes, more people will benefit from the service you are doing. So we are grateful to you.
Yes, awareness plays a very important role. That's why this year's theme of World Diabetic Day was also awareness and educating people. So when it comes to the economic burden of diabetes, what, especially with respect to India, what would you say that what chunk of a person's income will be spent on diabetes treatment, those who are affected from diabetes?
So, Bhupendra ji, this is not my domain, economics. Right. I want to tell you facts, simple facts. Okay. First thing is that the cost of diabetes care is in the complications. And suppose a diabetic patient gets a heart attack and has to do angioplasty or bypass surgery, or gets kidney failure and has to do dialysis or transplantation, or gets a nerve attack and a stroke and has rehabilitation for stroke. So the cost of care for diabetes is not in the cost of treatment of diabetes. It is in the cost of complications. Right. So there are direct costs and indirect costs. Direct costs are related to the care of diabetes, which include lifestyle, mindful lifestyle experiences, including the food choices we make. Second is, of course, in the medication and the diagnostics for which they have to spend. That's a small cost. But the real burden which hurts the economy of the patient, the family, and the country indirectly is diabetes is seen in people in their productive life between 30 to 60. These are working people. So there is a work loss. And if they get complications which are serious, like a eye problem, where their retina is detached, they can't see properly, a nerve problem where they can walk properly, a foot problem where their feet has to be cut, a heart problem, or a kidney problem, or a brain problem, then the burden of cost is very high. And therefore, in US, they have computed this cost as billions of dollars. In India, we don't have very strong health economic data. And we are grateful to the government that they have now made diabetes as a priority and a commitment, particularly in the lifestyle space. And they have also, both urban and rural India is having the same challenges. For example, in every budget now, there is a budgetary provision for diabetes prevention and diabetes complication screening. Because as I told you, the real burden of the disease is in the cost of complications. And therefore, that ABEF approach, which I was telling you, A is for A1C, keep your 3 months average sugar at below 7%. B is for blood pressure, keep your blood pressure below 130, 180. C is for cholesterol, keep your LDL cholesterol below 50. D is for diet, E is for exercise, F is for feet. If you follow this simple formula, which is economical, for every person living with diabetes, you will not, this is for type 2 diabetes, of course, and it's applicable for type 1 also, you will not get complications. And if you don't get complications, then for that family, for that member who's suffering from diabetes, as we like to call people living with diabetes, not diabetics, we call them people living with diabetes. We want to empower them. We want to make them, our messengers for behavior change. Their cost can be saved. And also remember, India has the most economical and affordable medicines on planet Earth. India has a dual system of healthcare delivery. There is the public sector, where the spend has gone up significantly with the Ayushman Bharat and the Jan Aushadhi scheme, where the most affordable medicines are available on planet Earth, including the cutting-edge medicines, as well as and we are very proud of that. And we are grateful to our Prime Minister and the entire team for doing that. At the same time, in the private sector also, all the medications are available, and they are also equally affordable in access. Some of them might be a little out of reach from very poor people, but most Indian middle class can have access to good quality diabetes care. It's all in education, it's all in motivation, and it's all in organizing their life and following up with their healthcare provider or doctor. Specialists of diabetes are called endocrinologists, and it's ensuring that they are appropriately taken care of.
All right. So it is very important to be aware and to act in such a way that you don't then at the later stage your diabetes expense don't get handy, so it doesn't become a lot. So what are your expectations, budget expectations with respect to diabetes? I was reading the previous year's allocation for National Health Mission, which also contributes a lot to the diabetes care. So that amount has remained somewhere stagnant between 30 to 35 crores. So what do you expect from the budget this time for diabetes?
I think all of us have a lot of expectations and hopes. We need to mix and match expectations and hope. But I'm very hopeful and grateful that Government of India is now trying to give insulin free for all children and adults who need insulin for life. We should not have any person. We have just celebrated 100 years of insulin. And I think I'm grateful that in this budget, they are having a provision for the center and the state to make insulin available for all children and adults with diabetes. So that's the first big takeaway. Second is, yes, we want more allocation for diabetes in the space of prevention, in the space of screening and diagnosis of complications. Because if we invest more in prevention and preventive programs, and India has now these programs, the think tank is in the center, the execution is by the states. That is how healthcare delivery happens in India. I think the model is getting better and better. We saw that in COVID also, we had one of the best models on planet Earth. And therefore, we are expecting a larger allocation of our GDP for healthcare spend. And we are seeing that occurring over a period of time. And also the key in diabetes prevention is on poshan, which means it is on food provision and it is on nutritional eating habits. And we are seeing a large allocation also related to preventive schemes, promotion of lifestyle, promotion of yoga. has a huge impact on diabetes prevention, because yoga is a very good adjuvant. And even now, American Diabetic Association, as well as ESD, as well as IDF, recognize yoga as a adjuvant, means add-on tool in diabetes prevention and care. So it's very, very important to recognize that we are trying to make people living with diabetes, particularly who can't have affordability and access, who are below the poverty line or poor or have challenges, they should be able to get diabetes care from the small rural or urban health clinics. And diabetes care also, we want more capacity building. Because you see, when you have 75 million people living with diabetes, another 75 million people living with pre-diabetes, you don't expect 1,000 endocrinologists or 5,000 diabetes experts to take care of all of them. So we need to train our ASHA and USHA workers and make them capable and competent to handle people living with diabetes. And to educate them and to train them, we want a budgetary provision so that they can be trained and empowered so that they can look after our people with diabetes. So those are the areas which we are looking up to the government. And I'm sure that they have always been thinking ahead of time. We are the G20 leaders. And I'm certain that we will have all these provisions in place when it is unveiled.
All right. So diabetes being a multifactorial disease, which approach should we have in terms of treating diabetes? Should it be a monopathy or an integrated medicine approach?
I think diabetes care is multidisciplinary, and integrated approach is always useful. It's all about lifestyle. It's all about supervised medications, oral and injectable. And it's all about care for complications. And it's all about prevention. And we have to have a holistic view. So we have to take best of all pathies also, but we need to do science around that. So as I said, that, with the diet, exercise and sleeping habits, if you do yoga, mindfulness, pranayama, it is helpful. Abdominal fat, if somebody has and they do Kapalbhati, it is useful. But with that, if the 3 months average sugar is 9%, they need to take the medicines, 2 or 3 tablets, or maybe insulin under medical supervision. They need to take pills to take care of their blood pressure. They need to take pills to take care of their cholesterol and save them from heart diseases. So it's important to recognize that we need to integrate the traditional practices, the Indian systems of medicine and the modern medical systems in an evidence-based fashion. Because today we all our recommendations are evidence-based. And in the evidence-based recommendations, particularly in the lifestyle space, the Indian systems and habits have been scripted much before allopathy was born. For example, the lifestyle habits which we have, the dinacharya which we have, has been scripted much before 4,000, 5,000 years back by our ancestors, by our sages. And we need to be mindful of that without being dismissive about it. At the same time, we should take care of our people with diabetes with the simple, affordable, accessible medicines, as well as they should take care of their complications. Because we don't want complications to cripple people living with diabetes. See, diabetes people live shorter, around 8 to 10 years than normal people. We want them to live longer. But it's not just about longer life. It's also important that they need to live longer without complications, and they also should be happy. So the last point is happiness. And happiness and mindfulness is something very Indian. And therefore, if somebody has to be happy without stress, but careful, without being reckless, I think a lot of our, integrative systems of medicine encourage health and happiness in a good way. So we should take the best of all worlds in a scientific and a rational way and do rational prescriptions, rational lifestyle, and which is careful and appropriate.
Okay. So taking mindfulness forward into mindful eating, because we have a growing population of younger Indians who are being diagnosed from diabetes, what suggestions would you make, especially in terms of their diet, what they should have?
And this is the most important question. We are what we eat. And we need to, first thing is eat less. We need to eat slowly. We need to eat on time. We need to have a large breakfast, moderate lunch, light dinner. There is a chronobiology of eating. We need to eat mindfully. So you can taste and share. Don't eat too much. Don't eat too fast. Eat on time. Eat less. Eat right. If we just do these simple things and don't get carried away by all these advertorials around food, which are influencing our children, because they are promoting fat and weight gain, as well as they are promoting, ultimately, indirectly diabetes. So be mindful in eating. You can taste and share. And just focusing on eating is not important. When you eat, we need to also do some form of exercise. We need to also be a little bit of, focusing on our sleep and having at least a good 6-7 hours of sleep or 7 hours of sleep is ideal. Equally important is to smile. Also remember, sitting is the next smoking. So don't be sedentary on your couch or a chair. Try to have a brisk walk every 5-10 minutes. So try to break the chain. Try to do brisk walk. Try to encourage a good lifestyle. That's really the key.
All right. Sir, we have in our society, because of the lack of awareness, many times what happens is that if I'm newly diagnosed with diabetes, I will look or take um, advice from my relative or family member who is on medication, and then I'll try to copy the same. I'll take the same medicines. Why is this approach wrong? And how subjective diabetes can be to different people?
I think taking a relative's advice is not the best care. I think you can take them for motivation and ask them how they handle their problem. But I think you should go to an expert. It's important to go to an expert once. For lifestyle changes, you can take a dietitian or the healthcare team of the expert. Once to maintain a good glucose control, if your relative or your friend or your family helps you, it's great. I'm not saying I'm decrying it, but every person living with diabetes is different. Somebody may be type 1 diabetic, somebody may be type 2 diabetic, somebody may be secondary diabetes. A doctor has to medically examine you, do some tests, find out what is the degree of complications, how advanced the disease is, what is the duration of diabetes, what is the degree of control of sugars. So there is a lot of science behind this. So don't shortcut science and don't shortcut that. Once you are under control, still you need medical supervision. Then the frequency of visits can be reduced. And we can do these visits also digitally later. But I think seeing your friendly neighborhood doctor who has expertise in diabetes is something which must be done and should be encouraged. And I don't think it's a good idea to take a friendly neighborhood advice, because some of these advices may not be evidence-based. Some of them are picked up from different spheres of life. We know so many influences we have today in our modern world. But I don't think some of them are scientific. So don't go by anecdotes. Don't go by hearsay. Don't get influenced by peer pressure or family pressure or relative pressure. Try to do it scientifically and under medical supervision of an expert.
All right. Even lately, I was going through some documentaries. I think it was called "What the Health," and they were promoting a substitute diet. The Indians, we usually have a carb-rich diet, and they were promoting other like protein-rich diets, especially from the vegan products. But somewhere they were also packaged products. So, how important is it to refrain from the packaged product and take the fresh food?
So we should be balanced and scientific in our approach. We need to, as I said, eat less, eat mindfully, eat on time, eat right. These products have to be scientifically validated, and they must have had a randomized controlled study to support these advice, and they should be given under medical or a dietetic supervision. So don't get carried away by all this. There's a lot out there in the internet world, and don't get carried away by that, because it's not evidence-based or gone through the rigor of the evidence base. So, and there are a lot of myths. We did a STAR study for India. I was the first author. 2015 we published that study. And India eats more carbohydrates and fats and less proteins. And that is why we are sarcopenic. We have less muscle mass. So yes, improve proteins and reduce carbs. Simple advice. Reduce sugars, reduce starches, eat less. That's all you need to do. So it's not some rocket science. Even in the ICMR in-depth study, Lancet, Dr. Mohan published, I was one of the authors. We found that we can even remit diabetes by changing the carb to fat ratio. If you eat less carb and fat, and increase a little bit of protein, you can make that change. And we have proteins. We have simple nuts, like including ground nuts and so many other nuts, which are natural, which are there. And our population is predominantly vegetarian. We have a non-vegetarian population, but predominantly we eat vegetarian food. So we need to be also mindful of our cultural practices. See, food cooked in every Indian household is different. And foods cooked by our ancestors were in an agrarian economy. They used to eat those foods and then go in the fields and plow and be physically active. So that was designed for them. So try to get some scientific and rational advice, including these supplements. But I don't think necessarily these are the they have to be ethically and scientifically proven supplements approved by FSSAI, which is a regulator body, and they must go through some RCTs before they make such claims.
All right. When it comes to preventive healthcare, in diabetes, it seems difficult because the symptoms aren't as evident as the other diseases. By the time we develop symptoms, it's already at times too late. So what would you say about the proper health checkups that need to be done?
So I think you're very right. Diabetes is asymptomatic or a silent disease. And therefore, if you are having a family history of diabetes, get your glucose checked after 20 every year. Every time above 40, you should check your glucose regularly. And prevention has to be simple mantras. Eat less, eat on time, eat slowly, eat right, walk more, do yoga, do pranayam, sleep well, smile. If you have these simple things for prevention, you can make a difference, but keep checking. And particularly if the family history is strongly positive with diabetes, or if your waist circumference is more than 90 centimeters for a man and 80 centimeters for a woman, keep checking your sugar every year. That's my simple take on this.
All right. So keep your tummy in check. That's what we can say. Thank you so much, Doctor, for talking to us. It was great talking to you. And the way in which you have given us examples and in a simplified manner that you have explained the importance and the things that need to be done with respect to diabetes, it has definitely helped me a lot. And I will be definitely sure that the audience must be enlightened right now and they will be more mindful, not just in terms of their eating habit, their exercises. One thing that you have said, that don't remain sedentary. So every hour at least you need to, take a walk or something like that. Because at times, sir, we even especially in the young people, we give gym too much importance, that we think that going to gym will help us counter any disease or something like that. But regularly, motion needs to be done. Anything at last that you would like to add, sir?
I think there's be happy and be healthy. If you are not somebody who's living with diabetes, try to take care of people living with diabetes. If you have a strong family history of diabetes or you have abnormal waist circumference, try to keep checking your sugars and keep taking medical advice from time to time. Thank you very much, Bhupendra ji. Congratulations for being the IDF brand ambassador for educating people living with diabetes as well as people at large. I'm grateful to you. Thank you so much, and Jai Hind.
James, thank you so much, viewers, for watching this program. We'll be coming up with such programs in future. Stay tuned. Thank you.